Hi everyone, my name is Gabriela Mateo, and today I will be discussing the glossopharyngeal ninth cranial nerve. So to get started, the glossopharyngeal ninth cranial nerve is implicated in both sensory and motor aspects, and it does have bilateral innervation. The motor nucleus of the glossopharyngeal nerve is called the nucleus ambiguus and the inferior salivatory nucleus, which is located in the medulla of the brain. The sensory aspect of the glossopharyngeal nerve is implicated in multiple nuclei, such as the trigeminal sensory nucleus, which is located in the midbrain, pons, and medulla of the brainstem. We also have the nucleus solitarius, which is located in the medulla of the brainstem. And then the sensory portions are terminated in the medulla of the solitary tract nucleus, as well as the spinal tract nucleus of the trigeminal fifth cranial nerve. So going more in depth, the rootlets of the nerve do emerge in the ventrolateral aspect of the medulla in the brainstem. They then converge and exit through the jugular foramen of the temporal bone. The nerve then moves deeper to the styloid process of the temporal bone, and then which is right next to the stylopharyngeus muscle. So after penetrating the superior constrictor muscles, it then enters the base of the tongue. And then the ninth cranial nerve does have superior and inferior ganglia. Lastly, the glossopharyngeal nerve is implicated in parasympathetic properties, causing it to be located within the salivatory nucleus, which is located in the pons of the midbrain. And then the parasympathetic properties do maintain certain autonomic nervous system functions. And the part where the glossopharyngeal ninth cranial nerve plays in this is that it has control of salivatory glands. So the motor functions of the glossopharyngeal nerve does consist of motor control of the stylopharyngeus muscle to help lift and widen the pharynx. Then we also have sensory control through the glossopharyngeal nerve that consists of sensory information from the pharynx, the external ear, middle ear, as well as sensation and taste of the posterior 1/3 of the tongue. And the taste sensation of the ninth glossopharyngeal nerve is mediated through the petrosal ganglia, and fibers do terminate in the solitary tract nucleus. It is then sent to interneurons, which is then sent to motor interneurons to elicit ingestion. And this can be salivation, insulin release, swallowing. Now we're going to discuss certain pathways that the glossopharyngeal nerve has. And the glossopharyngeal ninth cranial nerve does have two visceral afferent pathways. So the first visceral afferent pathway that we will be discussing is a special visceral afferent function. And this is where the nerve mediates sensation from the taste receptors of the posterior 1/3 of the tongue and a portion of the soft palate. This information is then sent to the solitary tract nucleus, which we mentioned previously. Then impulses from the baroreceptors within the carotid sinus then convey this information concerning arterial pressure inside the common carotid artery to the same nucleus, the solitary tract nucleus. The second visceral afferent pathway is the general visceral afferent component, consists of sensation of touch, pain, temperature of the posterior 1/3 of the tongue, and it also, as well as from the fascial pillars. And these pillars separate the oral cavity from the oropharynx. It also has sensation for upper pharynx, the eustachian tube, that is inferior, and to the inferior ganglia, the eustachian tube to the inferior ganglia. Then we have the general somatic afferent, which is information from the region behind the auricle and external auditory meatus, the external ear, which is then transported to the superior branch of the glossopharyngeal nerve to the nucleus of the spinal trigeminal through the superior ganglia. As mentioned before, the glossopharyngeal ninth nerve is implicated in both the superior and inferior ganglia. So now we are going to discuss the two different efferent pathways, detailing different motor movements as well as autonomic nervous system functions of the glossopharyngeal ninth cranial nerve. The first one we will be discussing is the efferent innervation of the ninth nerve that includes the special visceral efferent pathway. and it's the activation of the stylopharyngeal and superior constrictor muscles of the nucleus ambiguus. We then have the second efferent pathway, which is the general visceral efferent, of the parotid gland, and the parotid gland is located in front of the ear and below the cheekbone, and this is for salivation, which comes from the inferior salivatory muscles through the ganglia. The parotid gland does help administer tactile sense, thermal sense, pain sense, joint and tendon sense of the face and oral cavity. And this is mediated through the 9th glossopharyngeal nerve for this particular gland. There are 2 other salivatory glands that work in conjunction with this, and that is also with the help of the 5th trigeminal cranial nerve and the 10th vagus cranial nerve. And the parotid gland is also important in the active and rapid propulsion of the bolus, which it could be food or water that it goes into and through the pharynx. And so this glossopharyngeal 9th cranial nerve is important to us as speech-language pathologists. Why? So it is important to us because we can have a result of voice abnormalities, and this can be presented as a hoarse voice, a nasal voice, a whispering voice. If a patient is observed having difficulty moving the muscles that is needed for speech, this could be damage of the 9th nerve, and can be implicated in dysarthria. We also have the 9th nerve working in conjunction with the 10th vagus nerve, and so damage to the 9th nerve can result in paralysis of the stylopharyngeus muscle, resulting in the inability to turn your head from left to right, as well as the inability to control swallowing of the constrictors of the pharynx, as they would lose its function. And this can be a contributing factor to dysphagia, which can be difficulties in swallowing. So another result of the general loss, another result of damage to the cranial 9th nerve is loss of sensation to the 1/3 posterior of the tongue and loss of sensation of the pharynx. If there is damage to the 9th cranial nerve, particularly regarding the parotid gland, which is in front of the ear, below the cheekbone, as mentioned, it can affect the secretions of the salivation to the pharynx, causing reduced sensation. So it could affect the pharyngeal stage of swallow, as the type of saliva that is needed for this stage of swallow being secreted becomes thinner, and this disrupts the facilitating of movement of the bolus going into and through the pharynx, resulting in swallowing difficulties. This can also be transferred in difficulty in speech, as the inability to control your salivatory glands can result in dry mouth. You can also have poor uvula reflex, which your uvula is needed to lift for certain speech sounds, which can affect your speech intelligibility to a degree. You can also have a poor gag reflex, which can result in choking, since the bolus that is moving through and into the pharynx is being disrupted. You can also have difficulty with various food sensation or taste, such as sweet foods, salty foods, bitter foods, and sour foods. So there is one condition that you can have if there is damage to the cranial 9th nerve, and that is glossopharyngeal neuralgia. And glossopharyngeal neuralgia is a rare condition that has an unknown cause, but it is suspected that it can be caused by a tumor. And the way glossopharyngeal neuralgia presents is that it could be pain in the back of your throat, pain in your ear, pain in your the back of your tongue. And this pain is usually triggered by chewing, swallowing, laughing, or even talking. So all of these things are affected from damage of the cranial nerve if you do have glossopharyngeal neuralgia. So now, as we discuss the function of the glossopharyngeal nerve, as well as the motor functions, the sensory functions, as well as why it is important to us as speech-language pathologists, we will be discussing, or we will be testing this nerve on a patient in a little bit. Hi, so we are back, and I have our patient here, Eddie. say hi.
Hi.
And we will be testing the function of the glossopharyngeal ninth cranial nerve with him. So how are you doing today?
I'm doing good. How are you?
I'm good.
Thanks.
So as I can see, there is no abnormalities with his speech production, with his voice. If there were any damage to the cranial ninth nerve, his voice would have presented as hoarse or whispering or as nasally. But that's really great so far. So now I'm going to ask, do you have any swallowing difficulties or concerns?
No, I don't think so. Not at the moment.
Okay, so that's a good sign. We will be testing for his swallow, but because he so far does not present with any difficulty swallowing, we can rule out any dysarthria, dysphagia, or aspiration pneumonia. So now I'm just going to ask if you can drink this water, just a little bit. So this shows me that there was no swallow delay, which is great, showing that his stylopharyngeus muscle is working by moving the bolus into and down the pharynx. So now what I'm going to do is I'm going to sanitize my hands. And I'm going to take this glove and put it on. And take my tongue depressor so that I can examine his uvula and see if there's any discoloration to his palate. So if you can just say "ah" without sticking your tongue out.
Ah.
Okay. So I saw his uvula, his soft palate elevate, which shows that the elevation is working properly. Also, his uvula did not deviate to one side. If it did deviate to one side, it would have showed damage to the glossopharyngeal ninth nerve, and also the color was great. So everything seems to be working properly there. Now, what I'm gonna do is I'm gonna test his gag reflex. So first, I'm just gonna ask for permission. Is it okay if I can test your gag reflex?
Sure, go right ahead.
Okay. And you always want to ask this of the patient because it can be an uncomfortable thing to test for them. So I'm just going to ask if you can open your mouth, and I'm just going to touch the posterior of his tongue on both the left and right sides to make sure it's working properly. Okay.
Ah! Sorry.
It's okay. Okay. So as you can see, his gag reflex is intact, which is really great. There's no issues there so far. His ninth nerve is looking intact. So now what we're going to do is I'm going to test for his salivatory sensation and taste of the tongue. So usually your salivary glands for the glossopharyngeal nerve is located in the parotid gland, which, as mentioned before, is below the cheekbone and in front of the ear. So I'm just going to touch the glands to make sure that it's not swollen and that there's no abnormality so far. So, okay, everything seems okay. So now what I'm going to do is I'm going to take some sugar and put it on this tongue depressor. And what I'm going to do is put the sugar posterior to his tongue. As we mentioned before, the glossopharyngeal controls for taste and sensation of 1/3 posterior of the tongue. So let's see. Just open, say ah.
Ah.
Close your mouth. You can swallow it. Okay, so what I'm going to look for now to see if there's increased salivation in his mouth. Yeah, I can see that there's some strings of like saliva coming in, which shows that his parotid gland is intact. So there is no issues with his salivation. If there was issues with his salivation, it would have came across as no increased salivation in his mouth or reduced salivation. So there's no issues so far with his cranial ninth nerve. So that's really great, and thank you for being here with us today.
Thank you.
That's it.
Thanks for having me.
Thank you. Bye.